Welcome to Senior Living Executive Strategy with your host, Melissa Brown, for senior living leaders solving real senior living problems.
Hello, everyone. Welcome to the podcast today. As you can see, we have updated our name to the Senior Living Executive Strategy Podcast. We're really excited to bring this new approach. This has always been our goal and our target, and we hope that the title of our podcast now aligns with your expectations and help everyone who needs what we are offering find us easier. So looking forward to welcoming those who used to listen to the Gravity Healthcare Hacks podcast and new people that may have found us along the way as well. Today, I am excited to introduce Devin Kasey, our Vice President of Home Health Operations at Gravity Consulting. We are going to be talking today about the Home Health and Hospice Moratorium. Welcome, Devin.
Hello, Melissa. It's always great to be here.
Well, we're really glad to have you. I know our listeners are eager to hear about what this home health and hospice moratorium means for them. Obviously, we're a senior living focused podcast, but at the same time, we believe that most senior living should be investing in home and community-based services, home health being a very, very sensible one for a lot of senior living communities. So I think there's great alignment here. How do you see the alignment between home health and senior living today?
It's really an intricate part. As we've all veered away, healthcare is continuing to veer away, is what I should say, from being siloed. All of the different ancillary services being siloed away from the hospitals, from the skilled nursing facilities. We are all starting to work better together as a team where we're truly focused on what is going to be the best service that our patients and our families deserve and where they truly need to be.
Absolutely. I couldn't agree more. Well, in light of that, let's talk about this hot topic, the home health and hospice moratorium. We have a lot more expertise on the home health side, but really a lot of what we're going to talk about today would apply if you're considering hospice as well. So can you at a high level just walk our listeners through what is this moratorium, what does it mean for providers right now?
Yeah, absolutely. So on May 13th of this year, CMS sent out a memo stating that they were going to no longer accept new home health or hospice agencies nationwide. And I'm going to say that again, it's nationwide, every state. We weren't exactly, knowledgeable that this was going to happen. I think a lot of providers out there were a little shocked it went nationwide. We're all very aware of the fraud that is being done specifically in certain states. And this is the cause for why they are putting the moratorium in nationwide. They want to get the fraud under control and make sure that the people are actually receiving services and it's not fraudulent. Unfortunately, the majority of people out there are trying to do the right thing. Senior living companies, home health, hospice, home care, everybody's trying to do the right thing. But right now, they feel that this is something necessary that they need to do to be able to get the fraud under control. So at this point, what that means is that if you were looking to open a new home health agency or hospice agency and you did not submit your 855A into CMS, as of May 13th of this year, they are no longer accepting applications for 6 months. And that is the current time frame for it. They did state that this could be extended, but right now the current time frame is 6 months.
Yeah, with this current administration, we've often said it's almost like the Wild West. A lot of the typical things that we would have expected with previous administrations, they tended to follow certain protocols or standards. Who knows what will happen with this moratorium? I don't believe it'll get extended beyond 6 months because I don't really think there's good evidence that there is widespread fraud across the nation. I think the fraud is in certain geographical areas. I think there's a handful of bad actors that have really manipulated the system. And honestly, it should have been caught a long time ago. I'm rather disappointed, quite frankly, that Medicare did this. I don't think it was necessary. I don't think it was the right move. But nonetheless, I think as they examine some other states, they'll realize that this was really focused in a few key geographical areas. And I think it will open back up again in 6 months. What is your instinct on it, Devin?
Yeah, I'm confident as well. Everything that we've been able to review and talking with the accreditation organizations, we're confident that they can get this under control in those focus areas and allow the rest of the country to reopen to be able to provide services to people who deserve it.
Absolutely. Absolutely. And so, I think we get lots of questions we've been getting from clients and potential clients about what to do right now. So what would you recommend to somebody that wanted to start a home health agency? It's been on their bucket list or something they've been thinking about for the last couple of years. And wow, May, June of this year was when they were going to start getting things going. What would be your suggestion to them?
Yeah, if you're really serious about opening a home health agency and you have the funds to support it, our recommendation is to continue to move forward. And we're also hearing this from the accreditation organizations as well, is that continue to move forward with your state licensure, begin the process, obtain that state licensure and start to see your pro bono patients. And by the time that this all goes through, we're confident that within that 6-month time frame that we're going to start to be able to submit that 855A. And another strategy to do while you're doing this is not just to focus on the licensure, but also ensure that that 855A is ready to go, that you have every single aspect of that information that is going to need to be submitted for the 855A to CMS, that you have everything ready to go. So the day that the moratorium ends, you can submit it and get in line, because there are going to be a lot of companies out there who are going to be ready to submit and open home health agencies and as well as hospice agencies.
Yeah. And the biggest delay for getting your number, for getting approval from Medicare, all of that is whoever is in queue in front of you. And I agree with you, Devin. I think the very day that they lift the moratorium, if you're not submitting your application that day, if you're waiting till the next day or a week or two later, you're probably adding 3 to 6 months of cost to your organization, because there's going to be a glut of people doing this all at the same time. So lots of people are going to say, what's a couple days? It doesn't matter. That could be 2 or 3 months to your bottom line at the end of the year. And we know very well from helping home health agencies start up, time is absolutely money. Those months matter. So I completely agree with you, Devin. It's going to be all about being 100% prepared so that the second the moratorium ends, you're able to go put in your application. So let's shift gears and talk about those that might have just submitted their 855. Maybe they were lucky enough to get it in before the May 13th deadline. What's your advice to them? What do you think that they ought to do right now?
Yeah, continue with the process. As soon as you receive your state licensure, go ahead and start seeing those pro bono patients. And when you make it through a survey and you receive your CMS provider number, to go ahead and move forward with the process of admitting billing, setting up your billing, being able to start those insurance carriers. You want to make sure that you are also going to partner with Medicare Advantage plans, other commercial payers, to ensure that you're going to be able to have enough referrals to support your home health agency.
Definitely. And I think it's actually possible that the moratorium might help people that are already in the queue, if you got your 855A in ahead of time, to maybe have a faster than usual process, because there are not going to be surveys for the next 6 months other than people that are already in. So, hopefully for you, that is a positive and that gives you an advantage. I think one of the other things to think about is mergers and acquisitions. A lot of times people consider M&A as a solution to either expand their business or to get a home health agency off the ground. And one of the things to be really cognizant of is, of course, if the home health agency has been around for less than 3 years, then they cannot sell you that license without you having to go through the whole process of getting a new Medicare number. So if you're looking to do a merger and acquisition during this home health moratorium, you kind of have 2 things to consider. The safe bet is to go with someone that's been around for longer than 3 years, in which case you are able to purchase them and send their Medicare number over to your agency, attribute it to your agency, bring all their managed care payer contracts over, all of that kind of stuff. So that's really the safest, best option. Having said that, those are going to be the only ones everyone else is buying right now, so that could potentially escalate their prices. So if you're looking for a potential cost-effective strategy, you could use the current moratorium as a negotiating tactic to get the price down on an agency that's less than 3 years old. But just understand you're taking a lot of risk on, because we don't know, the moratorium could get extended. They might as a result of whatever fraud they find out, they might restrict the typical use of chows that we've seen in the past. There's just potential risk. So risk and reward either way, but just things to be thinking about. Anything else that you'd advise in line with that, Devin?
Yeah, I would advise that you continue the path that you are on. The only thing at this current point in time with the moratorium that you cannot do is submit the 855A. I would continue with the state licensure process. I cannot say that enough. Setting up the home health agency, creating your team, getting your clinicians in place, ensuring that your EMR system is set up correctly, that you have all of your policies and procedures, all of your meetings are in place. So the moment that you receive that state licensure, you can go ahead and start seeing your pro bono patients and moving forward, because by the time that you have all of that in place, there is a good possibility that the moratorium will be lifted. Also, too, please stay in touch with your accreditation organizations. They are going to be there to help guide you through this. If you are seeking accreditation, continue to have the conversations with them and stay up to date with anything that is going on in the accreditation organizations to assist you in this process. And so they know that as soon as this opens up, that you are going to submit that 855A. And once you receive your approval, then they can come in and do your survey. Continue to have your ducks in a row. And I do truly believe that this will not last extremely long. We don't necessarily know, but from everything that we are reading and hearing about the fraud, do believe that there will be locations who are not in the fraudulent areas that will open up.
Yes. And, I think you bring up a great point there, Devin, about the accreditations. When we're talking accreditation, it's something like CHAPS or ACHC. They are nationally recognized groups that are approved by Medicare to actually do your survey for you. And I think the moratorium makes those the perfect solution right now, because while you're still going to have to submit your 855 and it's going to have to get approved before they can do their survey, they're probably going to be able to get to you a lot faster than the state survey agencies are when this moratorium lifts. So yes, it's an investment. It's usually around $10,000 or somewhere in that vicinity, but time is money. Again, if you can get your survey 1 month sooner, that investment is absolutely worth it. There are extra things that you have to do to maintain the accreditation and to get it, but usually it's really worth it when you're doing a startup. So I think that's one thing to think about during this transition. Anything you'd add to that, Devin?
Yeah, I think utilizing an accreditation organization is a good way to go. They really want to be there as a good resource for you. They're going to help you to get through the process, guide you, and work through the survey. And anything that comes up, they're always going to be there to support you. It is well worth the investment to move forward with an accreditation.
Yeah, that's what I agree with you, Devin. I think it makes a lot of sense. Well, thank you so much for joining us today, Devin. I appreciate you being on the podcast. If you're listening today and you need some help deciding whether what you should do at this point based on the moratorium, how you should move forward, or you just need help with your home health agency, please feel free to reach out to us. You can always find us on LinkedIn. And of course, our information is in the show notes as well. Thanks for listening today. And if you enjoyed today's podcast, don't forget to subscribe. Remember, it's not just what you know, but how you apply it that makes all the difference. See you next time.
Senior Living Executive Strategy is brought to you by Gravity Consulting, an outcomes-focused consulting firm for senior living, skilled nursing, and home health organizations. If something in today's conversation connects to a challenge you're facing, or if your organization has an operational, clinical, reimbursement, or growth issue that needs to be solved, visit gravityconsulting.com to learn how Gravity can help.